Ma'am, yung sa approval and disapproval po ba yun?
Yes, yung non-therapeutic. Yung I'm surprised lang. Sige, habang hinihintay natin yung iba.
Pero malayo pa naman ako.
Asan ba siya? Bakit siya malayo? Sino dito sa inyong taga-Kabanatuan? Taas ang kamay. Si Jeline. Pagkasan ka, Jeline?
Bantog Norte po, ma'am.
Sino pa? Sino pa taga-Kabanatuan dito? As Jasmine, taga-san ka?
Daan sarili po.
Daan sarili lang. Lapit lang pala. Lapit lang sa akin. Sino pa? Dalawa lang kayo. Sino pang taga-Kabanatuan? Lahat kayo outside ano na? Puro ano na kayo? Neko? Ina. Ina, taga-saan po kayo? Where are you from?
Taga-Kapitan Pepe po.
Ah, Kapitan Pepe lang. Paolo, taga-saan ka? Bantog Norte. Sino yung taga Bantog Norte kanina? O pwede kayong mag-meet up. Nagkita kayo ni ano. Ako din po, ma'am. Hana. Taga-saan ka, Hana?
Continue po.
Campinyo naman. Tapos, the rest, ano na? Outside na. Meron ba kayong classmate na ibang time zone dito? Wala? Ah, Nesh. Taga-saan ka, Nesh? Asan ka, Nesh? Wala na.
Nasa Florida po.
Oh, what time is it there na ba?
It's 10 p.m. po.
Ah, okay. So, ano lang pala tayo, ano? O ay umaga, dyan ay gabi. O din po, ma'am. Okay, sige. Okay, tuloy tayo, Jasmine. Non-therapeutic communication, examples sa approval or disapproval.
Non-therapeutic. I'm surprised you're considering refusing hemodialysis. Tell me more about it. So this gives the patient a chance to express ideas or feelings without fear of being judged.
Okay. Sa approval or disapproval, minsan kasi yung mga patients, titingnan nila yung nurse as a person of authority. So, naghihintay sila ng approval from us. So, parang, oh, you're doing good, you're doing very well. Naghihintay sila minsan ng affirmation from us. But this one, bakit siya naging non-therapeutic? I'm surprised you're considering refusing hemodialysis. Tell me more about it. Okay. Disapproval implies that the patient needs to meet the nurse's expectation. Ayan, no? Disapproval implies that the patient needs to meet the nurse's expectation or standards. Minsan gusto ka nilang i-please. Gusto kang i-please ng patient. Instead, the patient needs help to explore their own beliefs and decisions. Bakit naging non-therapeutic yung communication na to? Is it non-therapeutic or therapeutic? I am surprised you're considering refusing hemodialysis.
Pwede ako.
Okay, Hana.
Kasi po hindi po siya nakatulong sa health po niya, di po nakatulong ma-improve yung health status.
Mm-hmm.
Kaya po ganun.
Ako po.
Sige, sino pa yun?
Ako.
Sige, Jasmine.
Para po kasing na-surprise siya na ayaw po nung patient na mag-hemodialysis. So parang yung choice po ng patient, parang nag-disapprove yung nurse sa choice niya.
Yeah, parang sinasabi niya na, ah, parang ayaw mo naman dati, pero bakit nagustuhan mo na ngayon? Parang siguro yung ano na to, yung situation na to, parang matagal na silang magkakilala ng patient at nurse, yung situation na yan. Tapos sinabi niya, di ba kahapon magkausap lang tayo? Parang ganun yung ano, parang kahapon lang ayaw mong mag-undergo ng surgery, but ngayon gusto mo na. Imbes, feeling mo, nagbibigay tayo ng approval or disapproval, nagbibigay tayo ng parang minsan na ano na yung boundaries ng nurse and patient relationship na gusto nating makatulong pero dahil may disapproval or approval, after kasi nitong sabihin mo to, pwedeng nag-iisip ko, nga no, gusto ko ba talagang magpa-dialysis o hindi? So nag-iisip siya ngayon kung tama ba yung naging decision niya. Okay, so other examples are na non-therapeutic, that's good. I'm glad that that's bad. I don't, parang nagiging parent tayo na hindi na siya professional way, na parang nanggagaling na sa atin yung validation. Na minsan, na akala ng patient, nai-improve yung kanilang health status kapag nag-a-approve tayo. Pero hindi naman sa atin nanggagaling yung approval dapat. Gets? Okay, so dito tayo sa defensive responses. Sige. Defensive responses is becoming defensive in the face of criticism implies that the other person has no right to an option. No right, ano? When patient expresses criticism, next ano tayo? The nurse should listen to what they have to say. Listening does not imply agreement. When you listen to another person, I'm not sure kung kayo yung kausap ko, no? We can agree to disagree. Parang yung mga nursing theories na napag-aralan natin, ano? Hindi naman lahat ng sinabi nila pwede kang mag-agree or dapat kang mag-agree. But nag-listen ka pa rin, pinag-aralan pa rin natin, tiningnan din pa rin natin. Bakit siya nag-come up bakit yung nursing scholar na to, ba't nag-come up na sa ganitong pananaw sa buhay? Parang yung concepts of man, ang dami nyo na iba-iba ang inyong naging agreement sa mga concepts na sinend nyo sa akin. Right? So, defensive response. Okay. What is an example of it? Sige, basahin natin. Si Mika. Do you have a book, Mika? Mika. Si Charlene. Charlene, are you here? Do you have a book with you?
Ma'am, wala po.
Si Paulo, do you have a book? Natanong ko lang. Alisa. Kian.
Wala pa po akong book, ma'am.
Sige. Si Paulo, sige. Mr. Guling, can you read sa page 160 yung example ng non-therapeutic tsaka therapeutic communication? Page 160. Okay, sige.
Ma'am, anong page po ulit?
160. Punta ka dun sa example ng defensive responses.
Sige po. Babasahin ko lang po yung example.
Yes.
Example, non-therapeutic communication. No one here would intentionally lie to you. Therapeutic communication. You believe that people are dishonest with you. It must be hard to trust anyone. Other examples of non-therapeutic communication. Defensive responses. This hospital has fine reputation, but Dr. C is a very able psychiatrist. I'm sure that he has your welfare in mind when you should consider yourself lucky. You have your wife to take good care of you.
Thank you.
Yun po, ma'am.
Okay, so yung defensive responses, nagiging defensive yung patient or yung caregiver. So you are defending your knowledge, defending the hospital, defending the admin, yun yung defensive na response. For example, yung wala naman ditong sasakit, wala naman dito na may gagawa ng masama sa'yo. Diba? That is defensive response. Pero siya, wala ako. Nawala ako. Siya, yung patient, naiisip na niya na someone or something might attack him or her. Pa siguro meron na siyang mga delusional na mga hallucinations na rin ng mga episodes. So, a non-therapeutic is wala namang may gustong manakit sa'yo dito o wala namang atake sa'yo dito. But a therapeutic communication na isang example, you believe, kasi paniniwala na yun eh. We will not hindi tayo magdi-disapprove sa paniniwala niya. You believe that people are dishonest with you. It must be hard to trust anyone, and then you can add, tell me more about it, para mag-open up ang pasyente sa iyo. Okay? So that is defensive response. Number 10 is passive or aggressive response. Passive responses serve to avoid conflict or sidestep issues. They reflect feelings of sadness, depression, anxiety, powerlessness, and hopelessness. Aggressive responses provoke confrontation at the other person's expense. Yung passive at aggressive, ito naman yung assertive communication. Between passive and aggressive communication, passive or aggressive response, ang magiging response ng nurse, ng caregiver is assertive. Yung assertive naman, bago pa mangyari ang sitwasyon, you are prudent enough. You're thinking of ways na pwedeng mangyari. You are assertive, you are proactive. Aggressive kasi, you are reflecting feelings na may anger na, merong ka ng frustration, you are, sinasabi mo na yung stress mo. Passive naman, yung nagre-reflect, yung passive, wala kang ginagawa. You are just waiting. Ang aggressive, umaatake. Parang ang passive is yung defense, parang ganyan. Yung aggressive is your offense. Okay? An example of non-therapeutic communication, things are bad and there's nothing I can do about it. Wala na po akong magagawa, ma'am, sir. Ginawa ko na po ang lahat. Although you are saying na you are telling the reality, but you are telling it in a way na parang wala na talagang possibility. Right? So that is a non-therapeutic communication. Number 11 is arguing. Ito naman, parang madali lang naintindihin, parang nakikipag-away. That is arguing. Arguing is, ito, basahin natin. Nakakatawa yung mga examples dito. Sige, si Jeline ulit. Si Jeline ang non-therapeutic, tapos ang therapeutic si Heart.
Ma'am, wala po akong book.
Ay, sorry. Si Stephanie. Stephanie non-therapeutic. Tapos ang therapeutic si Heart.
How can you say you didn't sleep a wink when I heard you snoring all night long?
Therapeutic.
You feel like you didn't get any rest at all night, even though I thought you slept well since I heard you snore.
Diba? Parang nang-aawa. Yung non-therapeutic, sabi mo hindi ka nakatulog, maghapon nga kitang napapakinggan na naghihilik. Diba? Parang sinabihan mo na siya kagad. Pag nagra-rounds nga ako sa'yo, pag nag-check ako sa kwarto mo, nakikita ko talagang ang lakas ng hilik mo eh. So that is non-therapeutic. A therapeutic way is, feeling mo hindi ka na well rested although nakatulog ka. Diba? You're telling yung observation mo, you feel like you didn't get any rest at all last night. Feeling mo, di ba? Parang ano yung tinatarget natin dito, yung feelings niya. Nakita nyo? Dun sa non-therapeutic, how can you say, sinasabi mo na hindi ka nakatulog, narinig nga kita. So, para siyang sarcastic in a way. So, that is non-therapeutic. Okay? Other examples, sige, si patient tsaka si nurse. Ang patient natin, Nina, do you have a book?
Wala pa po, ma'am.
Wala pa. Sino? Alam mo, wala ako sa ano.
Ako na lang po yung patient.
Mara, ikaw ang nurse. Ang patient ay sino pa yan? Si Karina, may buka. Okay, may buka. Nakamute ka.
Meron pa.
Oh, sige.
Opo.
Ikaw si patient, tapos si nurse, si Amara.
Okay na po. I am nothing.
Of course, you're everything.
I'm dead.
If you're dead, why is your heart beating?
Diba? Gawin kaya natin yun, mag-return demo kayo ng na meron kayong monologue. I'm nothing. Of course, you're everything. Sabi ni patient, I'm nothing, parang wala na akong patutunguhan. Si nurse naman, nakikipag-argue ka, china-challenge mo yung paniniwala niya. Of course, you're everything. Di sabi naman ni patient, ito naman, parang sarcastic din, patay na ako, feeling ko. Siguro yung feeling niya, parang wala na siyang silbi sa buhay.
Wala na pong pag-asa, ma'am.
Yes, wala na siyang pag-asa. Kaya na nasabing I'm dead. Ngayon naman, si nurse naman, ano yung sabi niya? Kung patay ka, bakit humihinga ka pa? Bakit meron pa akong nakikitang heartbeat? So, sarcastic yung way. Hindi siya therapeutic. Gets? Yan.
Yes.
Sige. 12. Matatapos na tayo. Giving literal responses. Okay. Tayo ulit. Sino pa yung may mga book dyan ulit? Si Hans. Si patient. Tapos sino pa yung kanina? Si Jasmine naman, si nurse. Gusto ko maganda yung delivery, ha? Maganda yung
I'm an Easter egg.
Sige, game.
I'm an Easter egg.
Nawala. Asa na si nurse? Nurse, si Jasmine. Nandiyan ba si Jasmine? Nurse, ano daw sasabihin mo? Sabi ni patient, I am an Easter egg.
Baka po nag-CR.
Wala na si Jasmine. Si Hana. Hana, ikaw si nurse.
What shade? You don't like one?
They're looking in my head with television.
With what channel?
O, diba? Bakit siya naging non-therapeutic? Sige nga. Natatawa kayo eh. So, ibig sabihin, merong mali. Tama? Bakit siya naging non-therapeutic? Sabi ni patient, ako po ay isang itlog. Ako po ay isang Easter egg. So, you are giving literal response. Nagiging sarcastic ka na. You are, iba to dun sa kanina na sharing observation. Iba yon. Yung ito naman, you are giving literal response. Alam mo na something is wrong with the patient. Tapos, ginagatungan mo pa siya na you are answering in a sarcastic way. Anong kulay, di ba? Yung sinasabi, itong siguro na mali lang tong you don't like one, you don't look like one. Parang hindi ka naman mukhang itlog yan. Ito naman, yung second, they're looking in my head with television. Feeling niya, merong nag-o-observe sa kanya. Feeling niya, lagi may nakatingin sa kanya. Ang sagot mo, anong channel? Diba? TV5 or Channel 2? So, sarcastic siya. So, that is a non-therapeutic way of communicating. So, those are therapeutic and non-therapeutic communication techniques. Okay. So, dito na tayo sa we have questions. Meron ba kayong mga question? Ano po? Sige nga. Ano ang therapeutic way kung sasabihin na, kung may nagsabi sa inyo, I am an Easter egg. Ano ang therapeutic communication dyan? Stephanie, ano naiisip mo? Kunyari, sinabi, may nagsabi sa'yo, ako po ay isang itlog. O, ako po ay isang manok. Ano ang therapeutic na response doon? Sige nga. Lechon ka ba? O ikaw ba ay ano? Di ba meron kang ganun? Ano naiisip niya? Sige. Paano mong sasagutin yon in a therapeutic way? Naisip ka? Always validate the feelings of the person. You feel like you are I understand.
You are.
Yan, I understand that you feel like you are an Easter egg. Tell me more about it. Parang lagi papa-elaborate mo lang sa kanya yung kanyang nararamdaman. But never tayong yung arguing, yung nakikipag-away ka, hindi ka naman itlog eh, tinan mo tao ka, tingin ka sa salamin. Ito yung nag-argue ka na in a sarcastic way. Right? So, dito na tayo sa okay, dito na tayo sa helping relationship. Yan. Helping relationship, pages 161 and 162. Merong phases of helping relationship. These are yung pinaka-essence nito, communication is a basic component of human relationships and nurse-patient relationship. The reason bakit natin pinag-aralan yung therapeutic and non-therapeutic communication, dahil ang number one natin na trabaho, objective is patient education, always patient education or client education, informing the patient, informing the client. So effective communication is a reciprocal interaction. If you remember yung transactional model kanina, there is a sender, there is a receiver, and there is a feedback. There is reciprocity, okay? It is a growth facilitating. Trust is the foundation, and the patient initially may test the nurse confidence. Ano ibig sabihin nito? Titingnan niya kung talaga mapapagkatiwalaan ni nurse. Merong mga ganon. Non-judgmental acceptance is of importance. Yan. There are phases of helping relationship. We have the pre-interaction, the orientation, the working, the termination phase. Yung pre-interaction, this is before meeting a patient. Nandito tayo sa page 162. You are reviewing the background, yan, yung data ng patient. Orientation phase, ito na yung the nurse and the patient meets together. They meet and get to know each other. So you are setting the tone for the interaction, for the relationship. That is the orientation. Working phase, ito na yung always remember, kailangan engaging, participatory ang ating patient. Never na ikaw lang yung nagpaplano for the activity of the patient. It is always you, the nurse, and the patient. Working phase is you are encouraging, you're helping the patient express feelings about his or her health, and you are taking action to meet the goals. Pinapakita mo sa kanya ano yung goals na gusto niya, and you are working together. Termination phase, from the word itself, termination, ending of the relationship or ending of the activity. Nandito na yung evaluation, titingnan mo na set ba natin yung goals natin, na-achieve ba natin yung ating goals ng patient, okay? So that is the phases of helping relationship. Characteristics of an effective nurse-patient relationship. Yan. Can somebody read? Yan, tulungan nyo nga ako. Can you read the whole, yung slide na lang na to? Yan, characteristics of an effective nurse-patient relationship. Sige. Who wants to read? Tawag ako. Andito ba si Ina? Ina, can you read?
Yes po.
Sige, thank you.
Characteristic of an effective nurse-patient relationship.
an intellectual and emotional bond between the nurse and the patient and is focused on the patient. Respect for the patient's ability to participate in his care. Respect for patient's confidentiality focuses on the patient's well-being and based of mutual trust, respect, and acceptance.
Okay, thank you. So ito yung characteristics of an effective nurse-patient relationship. Parang sinamarize lang natin yung mga napag-aralan natin, ano? Okay. So it is an intellectual and emotional bond between you and the patient. Intellectual because you are using your knowledge, your skills, your expertise. Emotional bond because you are kinocultivate mo na yung trust, yung relationship mo with the patient because you are going towards a goal. Ano yung goal natin? For the betterment, improvement of the patient. Yan. This is based out of mutual trust, respect, and acceptance. Okay. So we are done with chapter. We are done with chapter 7. Yay! 15 minutes break tayo, guys. Tapos, balik tayo dahil meron pa tayong chapter 8. Mabilis na lang naman ito. And, yan. This is patient education and teaching. So, break tayo ng 15 minutes and let us go back. Okay? Meron kayong question? Wala. Sige. Thank you. See you after 15